Good afternoon, everybody. I hope everybody made it into this meeting okay. First thing, if I can just ask everyone to mute their mics unless they're speaking. There, sounds like we have. Yeah, so good afternoon all. Welcome to this bi-weekly public health officials briefing on the N.W.T COVID-19 response. With us today is Dr. André Corriveau, Deputy Chief Public Health Officer, and Mr. Scott Robertson, Executive Co-Lead with the Health Authority's COVID response team. My name is Dawn Ostrom. I'm the Manager of COVID Communications at the COVID Secretariat, one of. Both Dr. Corriveau and Mr. Robertson will give some opening remarks here shortly, and then we'll do a roundtable for media questions, as always. Each media representative will get one question and one follow-up question, and then I will direct it to the appropriate person to respond. Yeah, so I'm going to do a quick roll call here, and if I've missed anyone, please just let us know in the chat. I believe on the roster for asking questions is Hillary Bird from CBC, Francis Tessier Burns, CKLB, Emily Blake, Cabin Radio, and Ian Down, Northern News Services. So again, if anybody got missed there, please just let us know in the chat and we'll get to you. Right now, I will turn it over to Dr. Corriveau for his opening remarks.
Okay, well, thank you, Dawn, and good afternoon, everybody. I'd like to start today by talking about where we are right now in the Northwest Territories and then where we are likely headed with regard to COVID-19. The N.W.T is still seeing a steady plateau of daily new cases of COVID-19, which has been hovering around 100 cases per day, which is most certainly an underestimate, given that not all people seek testing and nor report test results that are done at home. Part of the reason that we've seen this sustained plateau is first that I think the N.W.T was hit later by the Omicron variant than other parts of Canada, and also we have a more dispersed population outside of Yellowknife, and as we've seen in the past in other types of infectious disease outbreaks, it is spreading at different rates and times across our region. So it might be going down in one area and then it goes up in the next. So we're maintaining that steady plateau, and in Yellowknife being bigger, we have continue to have our daily share, and also we had however, our modeling was predicting this, so it didn't come as a surprise, and we are expecting to see more of a decline beginning within the next week. So that's of course we don't have a perfect crystal ball, but this is where we think we're headed to start seeing a sharper drop in the coming week. And the hopeful signs are that cases are dropping significantly almost everywhere else in Canada right now, and so that we should be following that trend like everybody else. The Canadian and international data and the N.W.T's experience confirm that Omicron variant spreads quicker and easier than previous variants. And when a person develops an Omicron infection, they are less likely to have a severe infection. However, the high number of infections means that we still have N.W.T residents in hospital with COVID, and we learned this morning that a sixth N.W.T resident had died from Omicron since the Christmas period. So one of the things that was concerning to me and to us was the fact that 3 of the recent deaths had occurred at home. So I want to take this opportunity to emphasize the importance for people to consult early if they're worried about their symptoms, or especially if they have a weak immune system or long-standing medical conditions or medications, and most particularly if they're not vaccinated, because now we have access to some preventative treatment like Paxlovid and the antibody. So I think it's important to mention it. I also want you all to know that the global committee is monitoring the new BA2 variant of Omicron. It appears by all accounts to be behaving like a slightly speedier form of Omicron with a higher transmission rate, but without evidence that it makes people sicker or that it is differently impacted by vaccination. So at this time, we don't think that this new subvariant, even if it did come to the N.W.T, would make a big difference in the trajectory that we're headed on. I know there's a lot of interest in getting more detailed COVID-19 statistics for our territory. However, I just need to emphasize again that because of our small population, it's not always possible for us to break down the cases by different groups or regions or communities without creating some real privacy risks. So the more recent high volume of new reports, as well as the frequent need to seek and verify missing information, also result in delays in our ability to do careful analysis. For example, just sorting out whether hospitalization was due to COVID or happened to be found incidentally, and so that we can provide accurate information. So what I can tell you today is that we've had a total of 82 hospitalizations since the pandemic began. 50 people were considered not to have been fully vaccinated. 32 had received 2 doses of vaccine, among whom 4 had received a 3rd dose. And 20 of those admissions have been associated with the Omicron so far, as compared to 62 previously, which is an indication of how less severe overall it is, because of course we had 3 times as many infections with Omicron than we had previously. So, but it's still, for the healthcare system, it's still a significant activity of people that require care in the hospital setting. COVID vaccines also have been found to be less protective against the transmission of Omicron compared to previous variants. We know, however, that 2 doses of vaccine still protect from severe outcomes, and that getting a booster dose within 6 months of the 2nd dose is even more protective against severe outcomes. The booster dose brings the protection back up to the 90% range against hospitalization. And this is, the evidence is quite solid across the country and elsewhere. This is very important for seniors in particular, and anyone who's dealing with a chronic illness. And that's why the Office of the Chief Public Health Officer recommends that all residents stay up to date with their vaccinations to maximize their level of protection. And and that's why we're continuing to promote the booster dose, especially for the higher risk groups. So now I want to take a little bit of time to talk about the future of living with COVID-19 in the Northwest Territories. It may seem counterintuitive to be discussing this now when we're still seeing quite a few cases in our communities. However, as I indicated earlier, we are turning the corner, countrywide, and we expect that we will be following very soon, and that we've learned together over the past 2 years what measures actually make a difference in protecting vulnerable individuals among us, without having to rely on broad mandatory public health orders. You may recall, or you might have heard Minister Green previously indicating that the public health emergency will be ending this spring, and over the next couple of months, all the existing restrictions will be removed on a gradual basis. We recently allowed schools to reopen, because the social and educational harms that closures impose on children now far outweigh the risks of getting COVID-19. And we're working closely with ECE and the school authorities to manage this transition. Other relaxations will be phased in over the coming weeks based on the last year's Emerging Wisely framework. And this will allow the resumption, for example, of leisure travel in the near future. And another will be to permit people living in small communities to isolate at home rather than in regional hubs when they return from southern travel. And the exact sequencing of measures to be relaxed or abolished altogether before the formal end of the public health emergency is still being worked on. But you can expect that announcements will be made as soon as they are, the decisions are made, and that we will communicate this information as soon as possible. It's been a very long 2 years. And while not everything is going back to normal, we are working hard on finding ways to maximize our health and well-being, so that we can move forward as communities and as a territory. So thank you, and I'll pass it to Scott.
Thank you, Dr. Corriveau, and thank you to everyone in attendance today. We always appreciate the opportunity to connect with the media to provide public updates and situational awareness and answers to your questions. As we continue to endure this Omicron wave, the landscape of COVID response and management operations continues to adapt. The health authorities in the Northwest Territories continue to monitor situations across the regions and provide support to health centers, schools, and long-term care facilities. The impacts of Omicron continue to put an incredible strain on our healthcare system. Aside from the increase in testing and the number of people who require monitoring and care because of COVID, many of our own staff have also been impacted themselves by COVID infections or the need to stay home and look after family members. This is one of the factors contributing to service reductions across our system. And while we adapt on a daily basis to minimize these effects, they are inevitable, and we expect these to continue for the foreseeable future. One of the best things that you can do to protect yourself, your communities, and the healthcare system is to get immunized and boosted. We have excellent data showing the effectiveness of booster doses in preventing infections and severe outcomes. In alignment with the National Advisory Committee on Immunization recommendations, all Northwest Territories residents age 12 and over are now eligible for booster doses at 6 months following their last dose. We always welcome you to come in for immunizations, even if you're starting with your first dose. Please contact your health center for an appointment, or in Yellowknife, you can book online. One of the additional tools we are using more during this wave are at-home rapid antigen tests. While we have a healthy supply of these in the Northwest Territories, we do need to preserve these for people who have an indication for testing. This includes people with symptoms, screening in long-term care and other facilities, and those who have been in close contact with someone with COVID. We are continuing to work with the Office of the Chief Public Health Officer and the federal government to increase our supply and options to make at-home tests more widely available to the public in coming weeks. While at-home tests are an additional tool, they aren't as accurate as other methods, and it's important to remember that if you have symptoms, to stay home, even if you test negative on an at-home test. Providing care to people with COVID who are at the highest risk remains a priority for our healthcare system. We want to ensure that people are still speaking with a healthcare provider about their symptoms if they are at higher risk. And this includes people with serious immune compromise who have multiple chronic conditions, are not fully immunized, or anyone who is worried about their symptoms. So if you fall into one of these categories, or if you are concerned about your symptoms at any time, please ensure that you're speaking with a nurse or healthcare provider about this. As public health restrictions lift, we can look forward to getting back to spending time with family and friends and many of the things that we enjoy. But with this, we want to be clear that we fully expect to see continued impacts and disruptions in the healthcare system due to COVID for many months to come. It has been a very long 2 years on all Northerners, and especially hard on our healthcare teams. We have administered almost 100,000 doses of COVID vaccines in the Northwest Territories, tens of thousands of COVID tests, symptom checks, and assessments. Every positive case, every outbreak, every person who needs to be seen in person adds to the workload. And we ask the public to continue to help keep us all safe and help our healthcare system by wearing high-quality masks in public, choosing outdoor settings when possible, staying home if you have symptoms, and please get vaccinated and boosted. I would particularly like to thank all the staff across the healthcare system for their exceptional efforts yet again, and in particular our community health and public health nurses and outbreak response teams who work very long hours every single day to provide care to our communities in the Northwest Territories. Thank you.
Thank you very much, both Dr. Corriveau and Mr. Robertson. And with that, I will open it up to questions from our media guests. And the first on my list here is Hillary Bird from CBC. Hillary, do you have a question for either Mr. Robertson or Dr. Corriveau?
I do, but first I just want a quick clarification. I heard Dr. Corriveau mention at the beginning of his remarks that there had been an additional death, and I'm just wondering if you can give a little bit of information on that.
Well, again, our main concern is to protect privacy for the family and the community. So at this point, we just wanted to highlight the fact that 3 of our recent deaths were occurred at home. So and that was an important concern of ours to communicate at this point.
Okay, go ahead with your next question.
Saying that there was you are saying that there was an additional death this morning, correct?
Yes, we just heard about it, so we don't have all the details.
Okay, sorry, that was just wanted to clarify that.
Yeah.
So my question, I guess, would be for Dr. Corriveau. We're obviously seeing restrictions, mask mandates, vaccine mandates and mask mandates being lifted in Saskatchewan and Alberta within a week. And you're saying that, we're, as the territory, looking to sort of make those decisions maybe in the coming months. Can you talk about why there may be such a disparity between the provinces and why maybe we're lifting these restrictions much later than, say, other provinces?
Okay, well, I mentioned one of them already in my introductory statement that, our wave started later than other parts of Canada, so we're still seeing a lot of COVID activity, and we feel that the timing has to adjust also to our epidemiology and should parallel the downward trend, the downward curve of new cases per day. So we think we're probably, at least 1 week away from that steady decline. And so that's basically our cue for, some of the more substantial relaxations. The other one is also, and Scott alluded to that to some extent, is we have a fragile, our healthcare system in the north is a lot more fragile than it is in other parts of Canada, because we rely often on, a small number of staff in communities, and our hospitals are, they've been, people have been working really hard, and we need to be, to titrate how quickly we go, but the goal is still there, and the intent is that the public health emergency will be gone within the next couple of months.
Thanks, Dr. Corriveau. Hillary, do you have another question?
Yeah, sorry, just a really quick follow-up to that. Do you see within those coming months, I mean, I know we're talking about a lifting of restriction, but do you see a lifting of the vaccine mandates?
Yeah, absolutely. That would be part of the package deal in terms of the requirement for proof of immunization. It doesn't mean that it would not be still something that is warranted in particular occupational settings, or but at this point the broad mandates would be included in the things that will be vanishing.
Great. Okay, thank you,
All right, thank you.
Hillary. Francis from CKLB, do you have a question for Mr. Robertson or Dr. Corriveau?
I do. Can you hear me okay?
We can.
Okay, great. Question for Dr. Corriveau to start. Just coming back to the 3 deaths that happened at home recently that you mentioned, Doctor. I guess maybe just speaking directly to our residents, especially those in our most remote communities. You know, we're seeing an outbreak right now in Uluhatuk. What is the recourse there for this to not happen? You know, these communities have very small health centers. Healthcare staff have been working very hard there. But yeah, if someone is getting very sick in our very remote communities, what is their recourse? What should they do?
Yeah, I
Well,
think that, oh, sorry, cut you off there, Dr. Corriveau, but I was actually going to hand that over to Mr. Robertson first, just with the health center capacity in smaller communities, and then I'll give you a chance to respond after that. Dr. Corriveau, if that's okay?
sure. Yes.
Thanks. Yes, as with anytime that someone has serious symptoms, they should be contacting their healthcare provider. In small communities, it's calling the health center. In particular, people that are at highest risk are those that have serious immune compromise, multiple chronic conditions, or are not fully immunized, and especially if they have a combination of those two. And those are people that we want to be talking to screen them to see if they need to come in and be assessed in person, or if they would be eligible for antiviral or monoclonal therapy that we do have available throughout Northwest Territories. So we are encouraging people that if they fall into one of those high-risk categories, make sure you're speaking with a nurse or a healthcare provider. And if you have any serious or concerning symptoms, arrange to come in and be assessed.
Dr. Corriveau, did you want to add anything?
No, actually, no. Scott answered everything I was going to say about, especially the availability now of monoclonal antibodies and you know, the antiviral drug that can be given early on for somebody who's at a higher risk and is not immunized.
Great. Okay, Francis, did you have a follow-up question?
I do. Thanks to both of you. A bit of a follow-up to what Hillary was mentioning around the easing of restrictions. I guess I'm just curious if we have a specific target that we're looking at or specific triggers for when this is going to happen. In, you know, last year, Emerging Wisely, we had case numbers or vaccination rates. Are these still being used, or is it basically the spring, this is going to lift no matter what the situation is looking forward?
Okay, Dr. Corriveau?
Yeah, so what I indicated is that we want to see a steady decline in our daily case count. So, you know, a trend that is steady, like until as of today, we're still hovering on a very high plateau of 100 cases per day. So, you know, when we had several days in a row where the numbers are going down, that's going to be our cue to get started.
But no specific numbers, I guess, is what I'm asking, really.
No, we're just looking at the trend.
Okay.
Thank you. Emily Wake from Cabin Radio, you have a question.
Hi, yes. I know Dr. Corriveau talked about why the territory's public health restrictions might be lasting longer than other jurisdictions. But of course, we've seen some residents in the territory that have called for restrictions to end sooner, and they feel that you know, it's an infringement on their civil liberties, and that the potential benefits aren't outweighing the negative impacts anymore. I guess, what would you say to those residents?
Well, the best I can say is that we're trying to go as fast as we can, balancing exactly what you said, the you know, the benefit of maintaining some measures versus the, you know, removing them, and removing them in a sequence that will not you know, cause you know, rapid re-increase, because the last thing we want to see is you know, having to go back to additional measures. So, you know, measuring the impact of each step that we take, and it will happen you know, soon, but I can't, you know, I don't want to you know, I'm not in a position right now to give you an exact date, but it's going to be starting soon.
Thanks, Dr. Corriveau. Emily, do you have another question?
Yeah, I know you mentioned that 3 of the recent deaths were at home. I'm wondering if, in terms of all the deaths that have occurred since the start of the pandemic, if you're able to provide more information about sort of age range or vaccination status.
Well, our numbers are still relatively small, so when we start to break it down by age group or vaccination status, we start going into very small numbers. But like I mentioned before, we still have the majority of people are either not optimally immunized or not immunized at all, and there's a combination. Of other factors related to chronic conditions and that influence as well. Like a mild illness in somebody who is already has a severe underlying lung disease can be life-threatening as it and in somebody else it wouldn't be. So it's often a combination of things. But when the idea is that we will publish, a more detailed analysis of our data, but right now our staff is basically just keeping up with receiving reports and providing an overview.
Thanks, Dr. Corriveau. I'm going to move on to Ian Down from Northern News Services. Ian, do you have a question?
Yes, hi. I'm just wondering, the last time I checked, it seemed like there were quite a few long-term care homes, I believe 8 or 9, where there was evidence of community transmission. So I guess I just wonder what the plan is to deal with that, especially given that it's affecting such a vulnerable population.
I can start with that. So the majority of our long-term care facilities, and I think all of them, in the last few weeks have been in outbreak status at one point or another. To be declared an outbreak location just means that we have to have at least one confirmed case in a long-term care facility. When that occurs, we implement additional measures for screening to try to mitigate the risk. We did see with Omicron that we had fairly extensive spread throughout our facilities. The advantage we had is we have very high immunization rates amongst our long-term care facility residents, and so we haven't seen any serious outcomes from that. But we continue to monitor that very closely, assessing anyone with COVID on a daily basis to ensure that they don't require any further follow-up care, and also assessing to see if they are eligible for other therapies such as antiviral therapy, given based on their immunization status and their other risk factors.
Thanks, Mr. Robertson. Ian, did you have another question?
Yes, my question, I believe, is again for Mr. Robertson. It's just related to obstetric services at Stanton. I know the N.W.T has said they're phasing in services once again, but we know what phase 1 of that is going to look like. But do we have any details or on what phase 2 is going to look like? So after March 31st.
I'll have to get someone to follow up with you on that specifically, as I don't have the latest information on the plan for that. But in general, as we've seen the ongoing impacts on staffing that we've seen with COVID, it does impact our services, and we have to continually assess that because, even if we put a plan in place, like we saw with Omicron, there are days we had 20-30% of our staff that were out of the workforce. And then you have to adjust your plan rather quickly in order to continue delivering core services. But I'm happy to have someone follow up with you on more details about the reopening plan for Stanton.
Thanks, Scott. So we have gone through the roster of reporters for first questions and follow-up questions, and we still have a bit of time. We have 4 guests with us today, so I'm going to open it up to go around the table one more time. I also wanted to mention that when it comes to statistics questions, if you want to send those to the comms at gov.nt.ca email, we can take a look at getting what we can back to you. But as Dr. Corriveau had mentioned earlier, we have to be careful with privacy. So we can take a look at that and see what is available for us to give out and what isn't. So if you wanted to do that, that would probably be the best route. And with that, I'll go back to Hillary Bird to see if you have one more question.
Oh, great, thanks. Yeah, I have a question, I think, for Dr. Corriveau, or maybe for Scott. It's actually about the rapid test kits that are being given out throughout the territory. I know that the actual tests themselves say that they have to be kept somewhere between 2 and 30 degrees Celsius. But of course, we have heard reports of people out by the airport, standing outside, handing them out in -30, given to kids to walk home from school. I'm just wondering if you could talk about the effectiveness of these tests if exposed to, very cold temperatures like we've been having in the last month.
Yeah, that'd be Mr. Robertson. Go ahead.
Yeah, it's a really good question, and it's something that, of course, we have to deal with in the north. So the manufacturer says not to freeze them, and that's in their approved Health Canada instructions for use. But both Abbott, who makes the PanBio, and the VTNX devices, they did some testing to see if they could be frozen, if it affected the reliability of the test. And what they found is that if they did a frozen 3 times to see if it would impact it. And they said that it didn't have any measurable impact on the efficacy of the test. We do ask people to try not to freeze them. It's hard for kids when they're going home and they've got them in their backpacks and it's -40 outside to keep those from freezing. But we're all possible. We are asking people to try to prevent them from freezing. But the data from the manufacturer that they've done, and they specifically did this testing for Canada, was that it isn't impacting it when it's frozen and thawed those 3 times. At the testing center in Yellowknife, when we hand out the test kits, we are keeping them. We don't stand outside with them, where we have them kept warm, and we hand them off quickly into someone's vehicle to minimize the risk of those freezing. So if you do have a test kit, please try not to freeze it. But if it does get frozen, we don't think it actually impacts it. If it's just frozen a couple of times, isn't impacting the result. Overall, however, rapid antigen test kits are not as accurate as molecular or PCR testing. So they're pretty good at detecting a true positive. So if you test positive and you have symptoms of COVID, most likely it's a positive. But if you have symptoms and your test is negative, we still want you to isolate, because it doesn't pick up all of the positive results, especially when your viral load is lower. So if you do have symptoms, you take a rapid test and it's negative, don't assume that you're automatically negative. Continue to isolate for at least 48 hours. Take a second test. If you continue to have symptoms, then come in and see us for in-person testing and assessment, because there also are things other than COVID out there that might be making you sick. We want to make sure that we're laying eyes on you to make sure that we're providing with care.
Thanks, Mr. Robertson. We're going till 3 and it's only 2:33 right now, according to my clock. So Emily, if you have another question, you might as well go ahead. Emily, sorry, Hillary.
Oh, okay, good. Sorry, thought we were jumping over. Okay, just one more quick question. It's just kind of a clarification to something that Dr. Corriveau said. You had mentioned that the 3 most recent deaths were deaths that occurred in the person's residence. Can you talk a little bit more about that, and if you have any recommendations for people? That's actually quite shocking to me that they happened at home. So I'm just wondering if you can expand on that.
Well, I think both Scott and myself made the recommendations. It's about, not waiting to consult, because you might, especially if you're in the category that were mentioned, you're not immunized, or you have a chronic health condition, or you immunosuppress, or you have a combination of those. Don't wait and be, sorry, my phone's ringing here, so I'll turn it off. But yeah, it's really, those are the recommendations. That's why we wanted to have flagged this today during this press conference.
Thanks, Dr. Corriveau. Francis, do you have
actually
another?
Maybe I would add something. It's also, something, not just, we're not addressing this just to the individuals themselves, but this is we all take care of each other. So if you know somebody who's living alone, or that are, you can encourage people to, around you as well to do that. It's a collective, it's of collective importance that we pay attention to people who might be more vulnerable.
Thanks, Dr. Corriveau, for adding that in there. Scott, did you have anything else on this?
No, I just echo what we've said before. If you're concerned about your symptoms, call or come in to be assessed. If you're having severe symptoms, difficulty breathing, chest pain, call 911 or present to the emergency department. Unfortunately, like COVID kills people. Like we've seen this in hospital, out of hospital. Like this isn't surprise to us, but it is disheartening when someone dies at home, and we want to make sure that people are accessing care if they have concern about their symptoms and not just thinking that, oh, it's Omicron, it's mild, I don't need to worry about it. And like as we're seeing, people continue to die and have serious outcomes from COVID, and those are the people that we need to focus on right now with our healthcare system. So if you're having symptoms that you're concerned about, please call us or come in to be seen.
Okay, thank you. Francis, do you have another question?
I do, thank you. Question, I guess, to both guests this afternoon. Both of you have talked about how much of a strain the pandemic has put on our healthcare system. Dr. Corriveau going so far as to say, we have a relatively fragile system compared to others in Canada. Now, appreciating that the pandemic is an extraordinary circumstance, I'm just curious what conversations are happening to strengthen our healthcare system in the long term here, making it more robust to maybe withstand something that maybe is not to this extent, but something, similar that could happen in the future. Yeah, leave it at that.
Scott, you want to take that one?
On a good day, our healthcare system is like we're only a few people deep. Like I've worked in many communities across Northwest Territories where it's a 2-nurse health center, and so it's me and one other nurse. And I've been places where the other nurse had a family emergency, had to leave, so I'm the only person there in a community. So it's not like we have this this backup of people just sitting around waiting to jump into action. To do that, it's always been a challenge in the North because we work in remote places, and and we don't have unlimited resources. And even in larger settings, like in Yellowknife, we have a large hospital here, our territorial hospital, but even here we see these impacts with having to reduce services such as birthing services. It's something we talk about all the time, and it's something that we're having discussions about how we go forward, because things happen outside of COVID. Like COVID's not the only health problem we have, and that's just one of many things that occur. People still need access to care for many other reasons, and we are having internal conversations about how do we catch up to the people that may have missed out on routine screening or their immunizations or surgeries that have been delayed. Like this is a problem that the world is facing, not just us, and it's going to be a challenge. And COVID, just because the public health emergency is ending doesn't mean that COVID's going away. We're just approaching it differently. But that means we're going to continue to have outbreaks. We're going to continue to have people that are hospitalized because of COVID on top of everything else. And this will continue to have an impact on our healthcare system. So, we're going to have disruptions. I think we're going to continue to see that and have challenges in playing catch up for months, if not years to come. And this is a reality that I think that the world is going to face, not just us in the territory, but it's certainly something that is on our radar. We have discussions about it really on a daily basis, and try to adjust our plans. But we don't have unlimited nurses and doctors and occupational therapists at our disposal. And so we do the best that we can, but I think we're going to continue to see disruption in the short term, and we will adjust and prioritize our resources, as necessary. But I think this is a bit of a reality, not just for Northerners, but for the whole world. But in our smallest communities, we certainly, I think we're particularly vulnerable, and those are the places that we keep the closest eye on and look at ways to put more resources there as quickly as we can.
Dr. Corriveau, did you have anything to add on that, maybe around social determinants?
Yeah, well, the thing is, I'm sure there's going to be a lot of reviews that are going to be done about, what else do we need? I mean, the long-term strategy is going to have to refocus our attention on some of the reasons why people have chronic medical conditions and live in overcrowded types of situations that facilitate the spread of communicable disease. Those are not things that you can solve overnight, but that's where we need to refocus some of our capacity and energies on in preventing, better management and prevention of things like diabetes and cancer and other things that make people vulnerable to an infectious illness.
Yeah. And that's a really important point that I think often gets lost is the healthcare system, like we're the end of like the result of all those things that happen in someone's life, all those determinants. The healthcare system is often what is there to, to catch or to clean up afterwards what happens. It's like the analogy of, people keep falling off of a cliff and need an ambulance. Well, we need to build more, put more ambulances at the bottom of the cliff, rather than building a fence so people won't fall off the cliff. And that's really what the healthcare system is. Like we're so busy, dealing with the consequences of all these things that happen. Like Dr. Corriveau mentioned, like overcrowding is a big contributor to many communicable diseases in housing. But that's a hard problem to fix, and and it's a long-term fix. So the healthcare system is the one that bears the brunt of dealing with that in the short term, because if you have like COVID, spreads very quickly in especially in houses. So if you have 10 people living in a 2-bedroom house, of course it's going to spread, and of course you can't prevent that from spreading. But you can't build houses overnight, and so this becomes the problem of the healthcare system. And and this isn't unique to COVID. This is this is with many issues in healthcare. So yeah, it involves a rethink about where we put our efforts and our resources to prevent people from getting sick in the first place, rather than providing all those, having to spend all that effort to provide services to look after people once they're sick.
Thank you both. I'm not sure, Francis, I can't remember if that was your first question or your second, so I'm gonna ask you to ask a second unless you already did.
No, that was my first, so I appreciate the
Okay.
opportunity for another one. Look, I know that I'm kind of big, broad question here, and I appreciate both of you talking about the social determinants and also the realistic expectation of what's to come, even if our public health emergency is lifted come the spring. But Dr. Corriveau, you mentioned, the possibility of reviews. Mr. Robertson, the conversations that are ongoing on a daily basis. I guess I'm just curious if there are any tangibles that we can expect, within, let's say, the year, that these types of reviews and conversations are going to lead to changes, as opposed to just kind of the status quo that we've seen for the past 2 years is really what it comes down to. Yeah.
I'll start with Dr. Corriveau there. Do you have some ideas?
Well, first of all, I'm only here filling in for Dr. Kendall, but I mean, I'm just going by experience. I've been in the business for a few decades, and after when there's usually a large public health event, or and this is certainly a major one. Most jurisdictions will do a review of what they did well and what they didn't do so well, and recommendations follow, and things often get acted upon afterwards. But you need to have to be back in a calmer period to be able to do that when everybody's busy, doing the work. So, but it's going to come, and we certainly have some hope that. Even though COVID, like Scott said, is part of the ecosystem now, and we'll keep probably having to deal from time to time with variants. Right now we've achieved a fairly high rate of immunization, and especially with and many people have had the Omicron even though they were immunized, but they've had a mild infection, and now it's like a booster, for those people. There's good data actually that shows that if you've been immunized and you had a mild COVID infection, you're in a way super boosted. So we can expect with some trend towards the fact that usually the summer months people are more outdoors. Communicable disease don't spread as easily. That we might get a longer period of relative calm where we can recover some of our capacity and restore our our forces in a sense, and be better prepared for whatever might come next. And nobody has a crystal ball with regard to COVID because it's still relatively new in our history as compared, let's say, what we know about influenza that is so predictable. It comes just once a year during the winter months, and then it goes away to the other hemisphere. So COVID might end up being that way at some point, but it's probably too early to tell.
Thanks, Dr. Corriveau. Scott, did you have anything to add quickly there?
Yeah, I can appreciate I've spent most of my life and most of my nursing career in the North, and I've worked both on frontline as well as the policy level. And I was here for H1N1 in a similar role. And, we did a review after that, had some very good recommendations and things that we actually implemented afterwards that came out of that. So I think we'll see that opportunity. What on a broader sense, what I really hope that this does is allows us to refocus on the importance of public health, because public health is really boring. Like my background is in emergency nursing, and I'm a trauma junkie, or was. I loved the thrill of that, and immunizations and this was always kind of boring to me. But you realize it's those boring things that you do every single day that really make a difference. Like the reason why we have very few people that get sick from drinking water in Canada is because we test it every single day. And that's a really boring thing to do, but you do it. And the reason why you don't get cavities, you brush your teeth every single day, and it's boring, but you do it. You wash your hands every time you go to the bathroom. It's boring, but you do it because it works. So the need to focus on some of these very basic things and make sure that we have that good foundation is going to be an important piece. And that's something that tangibly that we are having very active discussions about. In fact, we've got a meeting tomorrow with the OCPHO to talk about some of our future public health strategies. But in terms of some of the catch-up that needs to happen in healthcare, I would expect that the health authorities in the territory will come up with something fairly concrete in the coming months to say, here's our plan about how we're going to catch up. But that also depends on the amount of resources that we have available. Like we don't have unlimited nurses and physicians, we don't have unlimited money. So we're going to have to, we'll say here's our plan about how we're going to catch up and deal with the realities of the healthcare system and the healthcare needs of the North.
Thanks, Scott. I'm not sure everybody would agree with you that public health is boring. That better not be your guys' headline tomorrow either.
I'll add one more piece of that. So about maybe 12 years ago, I wrote an editorial piece about the importance of hand washing called "Seduce Me with Soap and Water," and about how these really boring things never get the attention. Like if I wanted to buy a new rescue chopper, I could have a fundraiser tomorrow and have millions of dollars raised, and everyone would say, "Oh wow, that's so exciting!" And you can see it. It's very concrete, very tangible. You can put your name on the side of it. But trying to get people to get excited about increasing hand washing compliance in a hospital, like that is an incredibly difficult job to do, and not just here, but worldwide. So yeah, it's not that I don't think it's important. It's just it doesn't get the sexiness of like rescue chopper. So if we could, if our experts in the media could figure out ways to help us to sell that idea of making hand washing super cool, I'd be all over it.
Perfect. All right, recognizing that we went another round, we only have 10 minutes left. Emily, Cabin Radio. So it's just make sure our responses are a bit shorter maybe.
Hi, yes. My question is about Paxlovid. The last update I believe we got is that the territory was expecting a shipment at the end of last month. I was just wondering what supply and distribution and eligibility are currently like for that.
So we did receive our initial allocation of Paxlovid, and we have it positioned throughout the Northwest Territories, both in some of our hospitals and some of our regional centers, so that it's rapidly accessible to that. The criteria, I can't speak specifically to the criteria, I don't have that in front of me, but it's essentially people that have one or more chronic serious medical conditions, or they're unimmunized with chronic medical conditions, that they're assessed by a physician or nurse practitioner for eligibility, and then it is administered to them.
Okay, thanks, Scott. Emily, did you have another question?
Yes, we've heard from some communities that there are concerns about not having the same support that they believe Yellowknife has gotten in terms of, isolation or other supports with residents dealing with COVID-19. What supports are available to communities outside of Yellowknife?
So, Dr. Corriveau, I'm going to hand that over to you, but just recognizing that the supports are mostly provided by COVID Secretariat. If you don't get all your answers there, Emily, just shoot us an email, okay?
Yeah,
Doc-
yes, it is the COVID Secretariat that, and because I've only been here for a temporary period, I haven't spent a lot of time learning the details of how they support communities, but there's certainly a partnership with MACA with regard to and housing authority, but it's not so much the supports, I think, as the fact that it's more challenging in small communities where there might be a lack of housing where people can be isolated, and those kinds of structural issues at the community level. And I'm sure the Frontline is has some insight into that as well. I don't know if Scott can elaborate on it, but I think the Secretariat was put in place to support all the communities, not just Yellowknife, but of course Yellowknife and some of our regional hubs have possibly more options of what can be offered in that regard.
Yeah, and I can't speak to for other agencies, but certainly it's I know it's been challenging in smaller communities because everyone defaults to the health center if you need something, and we're often expected to solve problems that are well outside of something that's related to health. So I know that it has been particularly challenging in small communities, but I can't speak to what was or was not provided in small communities. So I defer those questions to the responsible authorities for that, or responsible agencies for that.
Okay, great. Ian Down, do you have another question?
Yeah, I want to ask a question just related to the hiring and retention of frontline workers, because I know that in the last quarter of 2021, the territory added, I think it was 20 frontline workers to workforce of something like 1,200, and I think 10 of those went to Stanton. So, and that's for the last 3 months of 2021. So it sounds now like Stanton still has days where 25-30% of their positions are vacant. And so I'm just wondering, what are we going to be doing differently in the future to try to attract more workers and also to retain the ones that we still have?
Okay, that'll go to Scott, I think.
Mm-hmm. Yeah, I don't have the specific numbers on our workforce immediately available to me, but there are two pieces of this. We have open positions for full-time work, but we've also utilized quite a number of short-term staff, particularly nurses and physicians who have come here. Either they have worked outside of their regular jobs, so on the weekends they come and help out at the testing center, or they go to communities for a week to help out, or they've come from other parts of the country on a short-term basis to provide relief. That's helpful in the short term when there are surge needs, but it's not something we want to have long term. So I can't really speak to the specifics of long term healthcare planning today. I don't have that information with me, but I'd be happy to have someone follow on that question with you.
Okay, 6 minutes left. Ian, final question.
Yeah, one thing I wanted to clarify is that I noticed on the website that includes lists of exposure and outbreak notifications, there's a lot of smaller communities, well, actually Yellowknife too, that have shifted from having specific locations listed to just general just general advisories for community transmission. And I guess I'm not sure how to interpret that. What does that shift in recording mean?
Dr. Corriveau, can you take that one?
Well, I think, there's a point where if there's broad community transmission, the point of listing specific locations becomes less and less useful, because people might, be exposed in multiple places. So it's really, I think it's important that we notify when the first cases occur somewhere, but there's a point where there's diminishing value in notifying every single site.
Right. Thank you for that. And thank you, everybody. It seems like we had a pretty good discussion here today. So I hope everybody got some answers to their questions, and enjoyed spending some time with Mr. Robertson and Dr. Corriveau this afternoon. So like I said before, if you guys have any questions that didn't quite get answered, or that maybe we need to take a deeper look at, send us an email to covid_comms@gov.nt.ca, and we'll make sure it gets to the right unit. And with that, thank you very much for everybody who came on here today. So we'll call it a good afternoon and talk later.